Hello, everyone. Thank you for joining us today. Our cancer care virtual seminar topic is interval breast cancer. My name is Carmen Boone, and I'm an reach coordinator for the Samaritan Cancer Resource Center, and I will be your host and moderator. This event is brought to you by the Samaritan Cancer Resource Center. We partner with anyone touched by cancer to provide the support they need to live with strength, determination, and hope into the future. This presentation is being recorded. All microphones are muted and will remain muted during this session. Please use the questions menu to type your questions and comments at any time. Time is reserved at the end of the session for questions and answers. Joining us today is Veronica Irvin, professor in public health from OSU, and Maritza Leon Guerrero, PhD student at Oregon State University. Thank you so much for being here with us today, Veronica and Maritza. Welcome. It is now my pleasure to turn the presentation over to you.
So good afternoon. Thank you so much for joining us today. My name is Veronica Irvin. I'm an associate professor and Celia Strickland Austin and G. Kenneth Austin III endowed professor in public health at Oregon State University. I'm joined here by Maritza Leon Gutierrez, who is a doctoral student at Oregon State University, and she and I worked together on this project as well as others at Samaritan. And we're here today to present about interval breast cancers, a little bit about them, and then what we did as a partnership with Samaritan. Just some disclosures. Funding for this project was provided by the OHSU Knight Cancer Institute Community Partnership Program, a grant program that supports communities across Oregon in addressing local cancer-related needs. And additional funding is from Oregon State University, specifically the Celia Strickland and G. Kenneth Austin III Endowed Professorship. So our project team. At OSU, we had myself and Maritza. We also had Jimena Ignacio Caballero as well joining us on our team here. And from Samaritan, we had Kristen Baker and Anthony Franklin from Samaritan Health Services, the research group, Stephanie Haggerty from the Samaritan Cancer Resource Center, and Danielle Bertoni, who is a physician, and she has changed institution, but actually did quite a bit of work for us as part of this project, reaching out to women. What is interval breast cancer? According to the National Cancer Institute, interval breast cancer is a cancer that is diagnosed during the time between a regular screening mammogram that appears normal and the next planned screening mammogram. So for example, if you had a screening mammogram today, October 11th, 2022, you had no symptoms and the test came back normal, no sign of cancer. Your mammogram would most likely be scheduled again for 1 year from now, October 10th, 2023. But between now and then, if you notice symptoms and you went in for diagnostic services and were diagnosed with cancer, that would be an interval breast cancer. That was a cancer that emerged between your screens following a normal or negative screen with no signs of cancer. From the literature, about 20 to 30% of all breast cancers are interval breast cancers. This definition of interval breast cancer only counts for women who are screened regularly. So inherent in our definition of interval breast cancer is the fact that women have to be adherent to screening guidelines, whether that be yearly or biennial. And so the interval is meaning the interval between the screens. So these have to be women compliant to screening and have a cancer emerge between the planned screens. From the literature, we've seen that interval breast cancers are often found at later stages than screen-diagnosed cancers. They can be more aggressive than screen-detected cancers and can have a lower survival rate than screen-detected. So I'd like to tell you a little bit more about this study that we partnered with Samaritan with. And this was to learn from women who had an interval breast cancer about their symptoms and what made them call and go into the healthcare and ideas they had for messages for other women about prevention. And what I like to say is up to date in the literature right now is really a lot of information just about data from medical records, diagnosis, But really, there's nothing out there that's known about the woman's experience. So again, we partnered with Samaritan to identify through medical records women who qualified for our study. They were part of Lynn, Benton, and Lincoln counties. They were female, ages 40 to 69, and that matched the screening guidelines. And as you know, there are some varied screening guidelines, but our ages was approximately 40 to 69. They had to have previously had a mammogram within the correct time period, and between their screens have found an interval breast cancer. All the screening, diagnosing, and treatment services had to have been done through Samaritan across one of these three counties. And we ended up interviewing 20 women for this study. This is a chart that shows a flow diagram about the number of women that we reached out to. So Samaritan identified 44 women through medical records. Samaritan, so either Kristen Baker or Dr. Bertoni, reached out to women. They were all mailed a letter, and then were followed up with a phone call. 4 could not be reached, and 12 declined to participate. We had, I have a little typo in my slides here, so I apologize. We had 28 women who agreed to have their contact information shared, 28 women. 4 we could never reach. 24 consented, and 4 never completed the interview. We just could never schedule it. So we had a total of 20 completed interviews. So I'd like to share with you information now presented that we learned from these 20 interviews. From women, when did she start screening? What was the frequency? And so there was a really wide range of screening history. So for some women, they may have only had one normal negative screen before they had an interval breast cancer. Some women had been screening over 20 years without any breast cancer. 60% of women started screening in their 40s, and 30% actually started screening earlier than age 40, in their mid to late 30s. We have quite a few women with a family history of breast cancer. 75% of women had consistently been having a mammogram every year since approximately their 40s. The other percent of women that aren't included here were women who did have a consistent mammogram, but the frequency fluctuated from either once a year to every other year. As we know, the screening guidelines had changed, so some women changed their screening patterns, but were still consistent with whatever guidelines they were following. This information we have presented here on this slide is of the 20 women that we spoke to, how many months after her last normal mammogram was she diagnosed with breast cancer? On the y-axis, we're going to have the number of women. On the x-axis is the number of months since the last negative mammogram. As we'll see, there's kind of some buckets, and it's really spread out across the 12-month period. So we had 2 women who were diagnosed within 2 months of having a negative normal mammogram. The majority of our cases fell within 5 to 8 months following a negative mammogram, and then we have women that were diagnosed in that last part of the year, 10 to 12 months following a normal mammogram, but had a breast cancer diagnosed before she came in for her next screening. And our point here is that the breast cancer was noticed and diagnosed throughout this 12-month window. What symptoms did she notice? The most common was felt or saw a lump. The lump continued to grow, get larger, odd shape in her breasts. Other symptoms were redness, pain or burning sensation, or tenderness. When did she notice? And by far, the most common answer was when the woman was doing a self-breast exam, which were some women who did do their self-breast exam, and some of the rest noticed while dressing or showering. And how long do women wait to call from when they noticed the cyst or the lump or the redness, something abnormal? And some women called within a few days. They called, and some women waited a few months. And the reasons really varied. For some women that waited longer, some already had scheduled exams set up that they were just going to wait to talk to their provider when they went in next. Some women just, time slipped by. They got busy during the day and would forget to call until they got home later in the evening. And so didn't want to call during non-business hours. But we have this wide variety of when women would reach out and different reasons that she would waited or why she called in right away. Who patients reach out to. Overwhelmingly, these are the two most common areas, and the only two we really saw was the primary care or the usual care provider. And the second was the gynecologist. And those were definitely women that women reached out to. Interesting, some women thought they had to reach out to their gynecologist and didn't realize that they could have reached out to their primary care provider. And again, quite a few women did reach out to their primary care provider. So these were definitely the two pathways that women reached out when she noticed symptoms. What was something interesting that we learned when we were talking with women was several women had had a previous non-cancer breast experience. And the most common was a cyst. So women had had a cyst at other times in their life that they had had checked out on their breasts that had been not cancer. And what women were telling us is often they felt that the cancer that when it emerged was in a similar area to where the cyst had been, on the same breast. And so for some women that had the cyst previously, they kind of doubted or waited because they had previously reached out and it had turned out to not be cancer. So some of them thought, well, let me just wait and see if this goes away, or I've reached out before and it was just a benign cyst. So now I'd like to talk to you, share with you a little bit about some of the messages that women would want to share with other women about interval breast cancer. And so I'd like to just kind of remind us about that these messages were geared towards interval breast cancer. So what would they tell women about interval breast cancers? And again, those are those that are diagnosed between the time of you having a regular screening mammogram until the time that your next screening mammogram. And on the next slides, we'll show some of the common themes from interviews that could be messaging topics or could be turned into some more health education and material. The first was awareness. The awareness that cancer continues to grow. And so here we have a few quotes from our participants. Just because you had a mammogram that's normal doesn't mean that you're not going to get breast cancer in a couple of months. And for some of them, they were surprised when they had the diagnosis because they'd recently had a negative mammogram. But then when we were interviewing, it said it made sense. Of course, cancer would continue to grow during that period. And another participant mentioned that screening isn't your ticket to a vacation. And that idea about being aware of your breasts throughout the whole year. That just because you had a screen doesn't mean you shouldn't continue to monitor your breasts. The next thing was, again, on awareness, but really specific to dense breast tissue. And we had a significant portion of our group that did have dense breasts. And so for some examples of quotes that women told us was, I have very dense breasts. They were not able to see anything. Really clarifying that it's harder to see tumors or something suspicious when there's dense breasts. And so here's another quote that said, and they just said it wasn't caught. My mammograms always come back with having dense breast tissue at the bottom of the mammogram. Well, now I know what that means, and that means we can't see your tumor. So a lot of women knew they had dense breasts, but didn't really know what that meant, and didn't know what that meant for the mammogram screening. And so really knowing that meant that this was harder to see on the imaging. Our next theme was listening to your body. And the idea that your body is telling you something, that sometimes you're too busy. And so the idea to make sure to listen to your body. Again, all these women were the ones who noticed the symptoms. All of them recognized something irregular about her breasts. And so making sure to listen if you see something that to really call in. And as you'll see from our next slide is the idea about being too busy, making sure to prioritize your health. And so the idea about don't wait because it can grow very rapidly. Our next thing was self-advocate, and that idea about making sure to get in and making sure to get treatment and seen right away. So the quote from one of our participants was, get in and get all those tests right away. Sometimes physicians feel like, oh, their mammogram's fine, they just had it, probably no big deal. But make sure to call in and be seen right away. And what I would say is that our women all mentioned that when they called in either to the gynecologist or their primary care, they were seen very quickly to see it, and were brought in to have either an exam or a diagnostic mammogram. So they were seen quickly by their provider. Another theme that came out was don't doubt. And again, these women that have been having possibly 20 years of mammogram screening. And the thought was for women, my first thought was, no, you just had a mammogram and there was nothing wrong with you. And so what most women said is, when in doubt, do it. If you're not sure, just call in and have them have a follow-up check. Have a provider order a follow-up diagnostic. And when in doubt, do it. Do not doubt yourself. The other thing we had was this, you're not ridiculous. You're not crying wolf. And women really didn't want to, especially women that may have already got called in before for having a non-cancerous cyst or something that came back benign, didn't want to seem ridiculous or, again, crying wolf. So here we have a quote saying, I didn't want them to think I was crazy because the lump was right in the area where the cyst always was. Or from another woman, I thought I was being ridiculous, and that's why I waited a full month before I even called. We then asked women for some suggestions. What kind of resources would you have wanted more? Like, how would we spread some of this information? And so definitely some common areas is how to do breast self-exam. And what I'd like to say before I go into the slide, all of our interviews were offered in English and Spanish, although we only had English language participants for our 20 interviews. So we went and presented these aggregate themes that we just talked about with you to some Spanish language educational communities of adults, just to get their feedback on interval breast cancer, some of our messages, and again, what would they have also wanted to know more about. So we're combining here what women in our 20 interviews told us, as well as what we heard from some of our Spanish language community education outreach that we did about interval breast cancers. And definitely overwhelming was how to do self-breast exams, English and Spanish. Reminder for women how to do self-breast exams, where to check across the breast, and really also the idea about maybe more visuals and more video or audio, or video presentation, I should say, for those with lower health literacy. So again, that reminder about self-breast exams and how to do it accurately. The other was awareness and knowledge of interval breast cancer. When we were talking with women, they really emphasized having pamphlets, health educational materials in waiting rooms, both when they're having a mammogram, when they're at the provider's office, and kind of again that reminder about this can occur between your screens, and that reminder again of self-breast exams and to call in right away. They also suggested having some sort of interactive display. So a lot of them, weren't sure what a lump felt like until they had a lump. And so then this idea of like, could there be something that some sort of models they could have in the waiting room that they could touch and feel to say, oh, this is what a lump, the size of a lump might feel like. They really again suggested doing these at clinics, again, in waiting rooms, if they could have more materials there while they're waiting, and other, of course, outreach community events. We also asked women about their experience through the treatment process, from the diagnostic through on, and they all mentioned access to a navigator. Some women use navigator services more than others, but they all really recommend having continued access to a patient navigator during the process, from when they're diagnosed through treatment. They were very helpful with screening, with connecting them to services. So again, really having that continued access to a navigator. Again, what we heard from, when we talked to some of our Spanish language community education outreach, was really more access for care for women and underinsured, and really some more availability for evening. So making sure that they were able to get in not during regular business hours, and really helping them understand the treatment process and financial options moving forward. And we did have a lot of requests for resources for self-breast exams. And what we have here today, for those of you that are interested in more self-breast information on how to do self-breast exams, is the Cancer Resource Center has some information they can email to you, both in English and Spanish, on how to do self-breast exams. And there are some laminated cards that you can keep in your shower. These are courtesy of the Pink Lemonade Project. And either myself or the Cancer Resource Center is happy to mail you a set, either in English or Spanish. On the next slide, you'll have contact information for both myself, Veronica, and Maritza. And again, you're welcome to reach out to the Cancer Resource Center, Carmen, for screening material as well. I'll end there and take questions from the audience. Thank you.
Thank you so much for sharing all this amazing information. Let me take over the screen. All right. So, to the audience, we're giving you a couple of minutes to type your questions, and feel free to write questions and comments in the questions menu. And while you are entering your questions or typing your questions, we'll go over some contact information and upcoming events. If you would like to obtain more information or resources about cancer, feel free to contact the Cancer Resource Center by phone, email, or visit our website. We also are in social media. If you are interested in upcoming events, please contact us to subscribe to our Cancer Resource Center newsletter. If you are interested in upcoming events, please contact us. We're going to be having detection and prevention of breast cancer next week on October 20th. And it's going to be in Spanish. So if you know any Spanish speaking group, please share this information with them. And in November, our first talk of the month is going to be metastatic lung cancer with Dr. Tedesco. Remember to register, check out our latest newsletter, or call us or send us an email. Now, let's go over your questions. Let's see what we have. What was your biggest takeaway from conducting these interviews? Or what was something that resonated with you most?
I think one of the things that we were interested in going in was really talking to women about, these are women who are compliant to screening, and what were going to be some of her reactions, and in terms of calling and waiting in. And I think the takeaway was that there was some women that had thought, oh, I just had my screen, or I've had a previous nonsense, an idea about waiting. And so I think just some of that perception about just had a negative mammogram and it's probably fine to wait. So really, I think that was one of the takeaways. I think the dense breast tissue, I think I should have known about that from the literature. Of course, dense breast tissue has been shown related to interval breast cancer. And I think it was really interesting with women saying, I knew I had dense breast tissue. I've known that for years. And I have it on my report that I get every year with my scan. But I actually don't know what that means. And so I think that is a great area. We would really like to create our next step, which I did talk about, is we're presenting this some more next week at Oregon Public Health Association, and then we'd like to publish it. And we'd really like to partner again with Samaritan to develop some materials for women, specifically about what is interval breast cancer and dense breast tissue, and what does it mean to have dense breast tissue. And so I think that was a takeaway from us, was another key theme. And then another one was, again, that idea about, women not wanting to be ridiculous. And I didn't want to bother, I didn't want to, call again. And so the idea about, none of the women, by the way, ever were made to feel ridiculous. So whenever they called in, they were seen very quickly, and they were taken very seriously by whichever provider they reached out to here at Samaritan. So they weren't treated like they were being ridiculous. They just had this perception that they were going to be. And so I think the idea about letting women know you're not ridiculous, we take this very seriously. This does occur, and we do want you to call in as soon as you notice symptoms so we can have these double checks. And I think that was, again, our bigger takeaways. Thank you for that question.
Thank you. Is there any correlation between the incidence of interval breast cancer and dense breasts?
Yeah, that's a great question. In the literature, there is a relationship between dense breasts and interval breast cancer. With women who have been diagnosed with an interval breast cancer, this is from epi studies that have been done with other data sets, were more likely to have dense breasts. We're still not the majority, So there's still a large majority of women who did not have dense breasts that did have interval breast cancer, but there was a correlation with a stronger probability or likelihood of that dense breast was related to interval breast cancer. And from the literature, there's two possibilities as to why that is. The first that is university discussed is the idea that the dense breasts make it the way that they look on the scan make it difficult to sometimes see something suspicious. So it masks it. And then there is some more recent literature, and it's not my area of expertise, I will tell you, but it's that that the dense breast itself might increase the likelihood of tumor expansion, tumor growth. And so there might be something about the biology itself, not just that it's being masked, but that it might happen. From the literature, we've seen that interval breast cancers could have, again, a higher relationship to younger age women. But again, when you look at the sheer numbers, you still have more older women, 50 to 69, that are being diagnosed with cancer. But you do see that group that are on the younger age as well. Thank you for that question.
Thank you. Who is more likely to have dense breasts, and is there a way to get rid of that tissue?
No, dense breast, there is some family relationship. It can be seen in younger women with dense breasts. It doesn't actually necessarily mean younger breast itself. There's no way to get rid of it. It just is, and it's just something that you have. And I'll be honest, I don't know if that changes over time. I'll say that over your life period. I don't have that information handy, but they tend to be more family history related well on dense breast. And there's really nothing to know about changing dense breasts, but the idea that some women, especially they have a family history of cancer, will be seen by different types of machines instead of a mammogram. They might have an MRI or an ultrasound or something, another type of machine or scan, and they just might be more wary of being cautious about what the results are interpreted. So it's good to, the provider will record whether or not you have dense breasts, and again, that will be listed in your reports coming back to
you. Thank you. Why don't they have women with dense breasts have MRI screening yearly as well?
I don't have the great answer for that. My thought is MRIs are more expensive. I think they have mammograms. Mammograms do tend to observe more often, are what's more used in the area. You have now the movement towards 3D mammograms. We do have a lot more women that are reporting having a 3D versus a 2D mammogram. But why more women aren't having more MRIs, my guess is just the logistics of it and the cost of it. But I'm not positive on that. It is something that women could speak to their provider about, but if she has dense breasts or if she has family history, about should they change their screening tools that they're using, the screening machines. And I would have a conversation with your provider about that.
Thank you so much. Any other questions, audience? Please write them down. If not, because I don't see more questions, just thank yous and good reviews of your talk. What I would like to let our audience know is that if you have any questions for our speakers that you would prefer to be answered privately, please email us at cancerresourcecenter@samhealth.org, and we'll be happy to send them to our provider, our speakers, and get the answers that you need. Okay, final seconds to write your question.
Thank you so much for just again. Thank you so much for having us and for letting us present. And we're really excited to have partnered with Samaritan on this, and we're looking forward to partnering some more as well. So thank you again.
Yes, and thank you so much. We're happy to have you. And it's great to share this new information with the community and our colleagues as well. So thank you so much, and you're welcome to our floor whenever you need. And for our audience, please fill out the survey that will open after the webinar has concluded. It will help us create better material for the future. And thanks so much to Veronica and Maritza for sharing their time and knowledge and their research experience with us. And thank you all who joined us. Now you may disconnect. Have a great day, everybody. Goodbye.